Imagine walking into the barn and seeing your horse gripping a fence rail with their teeth, neck arched, making that distinctive sound, that sort of grunting or gulping.
Yeah,
It's puzzling, isn't it? Often frustrating and, certainly concerning for any horse owner. If
definitely.
you've witnessed it, you know exactly what I mean.
Absolutely.
Oh,
And that behavior, as perplexing as it seems, that's what we call equine cribbing. Sometimes you'll hear crib biting or even wind sucking.
right.
And our mission today is really to take a deep dive into this complex stereotypy. We want to explore its, well, surprisingly multifaceted causes, the effects it has, which are often overlooked, and crucially, effective management strategies.
Okay.
We really want to get to the heart of what's happening and how we can, best help these animals.
So before we jump into the why and the how to help, maybe we should clarify what a stereotypy actually is in this context.
Good point. So a stereotypy, basically it's a repetitive behavior. It looks pretty invariant, like the horse does it the same way every time, and it doesn't seem to have any obvious goal or function.
Okay.
Think of it like a fixed, almost compulsive action. And cribbing is, well, probably the most common oral stereotypy we see in horses. It's a prime example.
And you mentioned the term windsucking. Let's tackle that one head on because it's such a common idea, this image of horses just swallowing air. Is that what's really going on?
Yeah, that's a really widespread misunderstanding. While the behavior is associated with air movement, the research shows that horses typically expel most of the air rather than swallowing huge amounts.
Ah, okay.
That grunting sound you hear, it's actually produced when air rushes through a part of their throat, the cricopharynx. Negative pressure in the esophagus pulls air in, and then it's expelled forward rostrally.
So it's more of a quick gulp and then a release, not like they're inflating themselves.
Exactly. Not like filling up like a balloon.
Yeah.
And, that distinction is really crucial because it changes how we think about the physical impact of the behavior itself.
Right. So it's less about them, vacuuming up air and more about some internal reaction. That definitely reframes the popular image.
It does.
So if they're not really wind-sucking like we thought, what is going on? What makes a horse start doing this? It sounds like it's not just one simple thing.
No, you're absolutely right. It's far from simple. The fascinating thing is that cribbing is multifactorial. Its causes are complex, usually involving a mix of things genetics, their environment, and their underlying physiology.
Okay.
It's generally seen as a coping mechanism, a way the horse tries to deal with stress or some kind of discomfort, often stemming from the environments we put them in, which can be pretty unnatural for them.
A coping mechanism. And I know one of the big theories involves this gut-brain connection. Can you unpack that a bit, especially the link to gut issues?
Yeah, absolutely. There's very strong evidence linking cribbing to gastric discomfort, specifically things like stomach ulcers or just generally increased stomach acidity.
Right.
And the mechanism is actually quite interesting. Cribbing stimulates saliva production,
Okay.
and saliva acts as a natural buffer for stomach acid. So the thinking is this might provide some temporary calming or even pain relief for the horse, almost like a horse's own natural antacid.
So the horse might literally be trying to soothe the stomach ache. That makes a lot of sense. How does their diet play into this whole picture?
Diet plays a huge role. Diets high in concentrates, great grains and low in forage like hay or grass, dramatically increase stomach acidity and the risk of ulcers. And that predisposes horses to cribbing. We see a pretty clear correlation. Your horses that crib often have more severe gastric ulcers compared to young horses that don't crib.
Wow.
It really underlines how fundamental proper nutrition is.
That's a really powerful connection.
Yeah.
Now, beyond diet, you mentioned environmental stress being a major factor. What kinds of management practices tend to bring this on?
Well, if you think about it, a lot of our standard management practices create pretty unnatural conditions. Horses evolve to live in social groups, graze almost constantly, and move around a lot.
Right, roaming.
Exactly.
Yeah.
So prolonged stall confinement or just limited turnout, it goes against all that. It leads to boredom, frustration, and frankly, significant stress.
Yeah.
And it's incredibly telling that you almost never see cribbing in truly feral horse populations. It really highlights this massive disconnect between how they evolved and how we often keep them.
That is striking.
Our attempts at convenience can inadvertently create chronic stress, which then shows up as behaviors like cribbing.
I can definitely see how being cooped up would be stressful for a herd animal. What about social isolation?
That's another huge one. Horses are intensely social. Keeping them alone, even if they can see other horses, can be incredibly stressful. Minimal visual or especially tactile contact is a known risk factor.
Mm-hmm.
Another really strong link is with weaning, abrupt weaning, or forced weaning, especially if the foals are immediately put onto concentrate feeds.
Oh, interesting.
Yeah, that's strongly associated with cribbing starting. Compare that to foals weaned gradually out on pasture, they have a much lower incidence. It's not just what they eat, but how they experience those crucial early weeks and months.
So sudden changes, unnatural social settings.
Mhm.
What about the feeding itself? The routine?
Well, not having enough access to long-stemmed forage hay or pasture that disrupts their natural trickle-feeding behavior. Horses are designed to graze pretty much constantly.
Right.
Long periods without anything to chew on can lead to both boredom and those GI issues we talked about, like acidity.
Mm-hmm.
And likewise, giving big, infrequent grain meals instead of smaller, more frequent ones. That bumps up stomach acidity and cuts down on the chewing time they need. You often see stereotypies, like cribbing, start right after an abrupt change, like suddenly cutting back a horse's hay. It shows how even small changes in routine can have these big ripple effects.
It almost sounds like cribbing could also be a response to just frustration, like not being able to do what they naturally want to do.
Exactly. That's another line of thought. The horse is thwarted in a natural goal, usually grazing, and that frustration channels into this repetitive behavior that sort of mimics the first step of eating, that biting action.
A redirected urge.
Pretty much, yeah.
Yep.
A redirect of that natural drive.
Okay, so we've got environment, gut health, but what about the horse itself? Is there a genetic component? Can they inherit a tendency to crib?
Oh, there definitely seems to be a genetic link. Thoroughbreds consistently show the highest prevalence.
Really?
Yeah, followed by warm bloods. That strongly suggests some kind of genetic predisposition. Contrast that with, say, standard breds, where the incidence is very low.
Interesting difference.
It is. And while it's not perfectly understood, studies do point towards genetic susceptibility. Demographically speaking, you most often see cribbing in an adult horse, usually kept in a stall, fed that high-concentrate diet we mentioned, and often used for specific disciplines like racing, jumping, eventing, dressage. Also, males, especially young horses, seem more prone to start cribbing, although interestingly, older mares are more likely to crib than older geldings or stallions.
That's a very specific picture. Now, what about the idea that it's almost like an addiction? That cribbing releases endorphins and becomes self-reinforcing.
Yeah, the addiction theory, or the endorphin hypothesis, that gets into the internal mechanisms.
Yeah.
The idea is that the act of cribbing triggers a release of endorphins, those feel-good hormones in the brain.
Boy.
This could create a pleasurable or calming sensation that reinforces the behavior, potentially leading to, well, something like an addictive cycle. We do see that cribbing horses have altered levels of certain hormones like leptin and gastrin and changes in things like dopamine receptors.
So brain chemistry changes.
Right, suggesting brain function adapts to chronic stress. Now, while research does indicate that opiates are involved in the neural pathways for cribbing, studies looking directly at whether cribbers release more opiates than non-cribbers, well, the results there are actually contradictory.
So it's not quite pinned down.
Exactly. The brain chemistry is involved for sure, but the exact addiction mechanism isn't fully confirmed yet.
Okay, that's helpful to clarify. What are some common myths or misconceptions about cribbing causes that we should probably debunk?
Well, a big one is just blaming it solely on boredom. If it were just boredom, you'd think stall toys would fix it, but they often don't really help much with the cribbing itself.
Right.
And surprisingly, sometimes increasing forced exercise can actually increase how much a horse cribs.
Oh, really?
Yeah. Also, the idea that horses just learn it by watching others, there's very little solid evidence for that kind of direct observational learning. Now, if a horse has the predisposition and is in the wrong environment where other horses are cribbing, they might start, but it's not like catching a cold from a pasture mate.
Got it. It's not just a bad habit they pick up. So if it's not just a habit, what are the actual consequences? What does this behavior do to the horse and, to the barn?
The most common and probably most visible physical effect is on their teeth.
The incisors?
Exactly. The upper incisors get this abnormal excessive wear, sometimes right down to the gum line.
Oh.
Yeah. And that's not just cosmetic. It can make it really difficult for them to grasp food, especially grazing, short grass. It can mess up their bite alignment malocclusion.
Which affects how they even start eating.
Fundamentally, it disrupts things right from the first bite, which has knock-on effects for digestion. And you can also see wear on the molars from associated tooth grinding sometimes.
Okay, so serious dental issues. What about colic? That's always the big fear. Is there a direct link?
Yes, there is a link, but this is where we need to be really careful about an old misconception.
Mm.
Cripping horses do have a significantly higher risk for various types of colic things, like simple obstructions, distension colics, sometimes even serious ones like epiploic foramen entrapment.
Okay, so the risk is real.
The risk is definitely real. However, the old idea was that they were swallowing so much air, and that caused the colic.
Right, the wind-sucking idea again.
Exactly. But research has largely shown that's not the main driver. Instead, the increased colic risk seems to be tied to the underlying issues, the alternate gut physiology, the brain-gut axis problems, the same factors that are causing the horse to crib in the first place.
Ah, okay. So it's not the cribbing act causing colic, it's the underlying problems causing both the cribbing and the increased colic risk.
Precisely. That's a critical distinction, and it's a huge shift from what many people learn.
That is a huge shift. Okay.
Yeah.
What other kinds of impacts are there on welfare or even performance?
Well, some horses can spend so much time cribbing that it genuinely interferes with their eating. They just don't take in enough calories, leading to weight loss or just being a hard keeper. Musculoskeletally, you sometimes see overdevelopment of those muscles on the underside of the neck.
Right.
And that could potentially interfere with proper collection and neck flexion when ridden. There's also a rare condition, temporal hyoid osteoarthropathy, a joint issue in the head that's been potentially linked to the chronic stress.
Okay.
And another observation is that a higher percentage of horses with certain neurological issues, like equine motor neuron disease, also seem to crib.
Mm.
And then, of course, there's the practical side, the damage to property, fences, stall doors, waterers.
Yeah.
They can really chew things up.
Yeah, the damage can be significant. It really sounds like cribbing touches almost every part of a horse's life, health, performance, even just barn management. So given all these complex causes and effects, what's the approach? What are the sort of holistic solutions for managing it?
Right. The core principle really has to be focusing on addressing the underlying causes. Providing a more natural, less stressful environment should be the priority rather than just trying to physically stop the behavior.
So fix the why, not just the what.
Exactly. A holistic approach is truly the most effective and, frankly, the most humane way forward.
Okay, so what does that look like practically? Environmental enrichment, stress reduction? How do we do that?
It really starts with maximizing turnout and social contact. Let be horses as much as possible. Ideally, turn out in groups for natural interaction and grazing. If group turnout isn't feasible, at least ensure they have good visual and, if possible, tactile contact with others. Then continuous forage access is absolutely critical.
The trickle feeding.
Right. Free choice, high-quality forage hay or pasture 2-4-7. It keeps them occupied, keeps their gut busy, and helps buffer that stomach acid. Using slow feeders, like small hole hay nets, can help make the forage last longer and mimic grazing.
Good tip. And what about the rest of their diet beyond the forage?
Definitely want to reduce the concentrates. Minimize those green meals, especially the high-starch, high-sugar ones. If you do need to feed concentrates, use smaller, more frequent meals.
Okay.
And consider feeds higher in fat and fiber. Generally, the diet should be mostly roughage, low in non-oat grains, and simple carbs. You could even substitute some fat, like corn oil, for carbohydrates in the ration.
Right.
Maintaining a consistent daily routine, feeding times, turnout times, exercise that helps reduce stress too. And regular, appropriate exercise is good for expending energy, reducing boredom. Although, remember that caveat. For some horses, forced or intense exercise might actually increase cribbing.
Right, that's important.
And while things like skull toys or lick treats might seem like a good idea for boredom, the sources generally say they're pretty ineffective at actually stopping the cribbing.
Okay, so focus on the big things. Turnout, friends, forage, routine. What about directly managing that gut health connection we talked about? That seems foundational.
It absolutely is a crucial piece.
Yeah.
The strong recommendation is always to consult your veterinarian. They need to rule out or treat any underlying GI problems, especially those gastric ulcers.
How do they diagnose those?
Gastrecoscopy, putting a small camera down into the stomach, is the gold standard for diagnosis.
Oh, okay.
And if ulcers are found, treating them properly with medication, like omeprazole is a common one, that can significantly reduce or sometimes even eliminate the cribbing behavior in quite a few horses. You can also discuss using antacid supplements or feed additives, maybe timed around meals, to give extra gastric support.
That makes total sense. Treat the actual physical problem first. Now, what about those physical things we see people use, like cribbing collars or straps? How do they fit into this? Are they a good idea?
The deterrence. They really need to be used with extreme caution, if at all. Cribbing collars work by applying pressure when the horse flexes its neck to grab onto something and crib.
So they physically prevent the action.
They can prevent the action, yes, while the horse is wearing it, but, and this is the critical part, they do absolutely nothing to address the underlying reason why the horse wants to crib.
Right. The stress or discomfort is still there.
Exactly. And because of that, they can actually increase the horse's stress level by blocking its coping mechanism. You might even see the horse crib more intensely when the collar comes off. Plus, if they don't fit perfectly, they can cause sores or rubs.
Okay, so potentially making things worse psychologically. What about other deterrents like paints or metal strips?
Things like anti-cribbing paints or sprays have a nasty taste, but they wear off, need constant reapplication, and horses often just find another spot or ignore them. They're generally seen as ineffective long-term. Covering surfaces with metal or using hot wire can deter, but again, it just leads to frustration, not a solution. Punishment is definitely not the way to go for a stereotypy.
So physical barriers are mostly just Band-Aids and potentially stressful ones at that. What about surgery? Is that ever an option?
Surgery, usually the Forcells procedure, is really considered a last resort.
What does that involve?
It involves surgically removing parts of certain neck muscles and sometimes cutting a specific nerve in the neck. The theory is that this makes it physically difficult or impossible for the horse to perform the cribbing action effectively, particularly making that gulping sound, which might remove the reward or satisfaction part of it.
Does it work?
Success rates vary. Some modified techniques using lasers report higher success, maybe an 80% or more reduction in the behavior, but it's invasive.
Yeah.
There are risks: infection, swelling, cosmetic issues, nerve damage, and the cribbing can sometimes recur anyway. And crucially, again, it does not fix the underlying psychological or physiological reasons the horse started cribbing.
Still not addressing the root cause.
Exactly. So it's really only considered for very severe cases, maybe where other strategies has completely failed, and the cribbing is causing major health problems like constant colic or severe weight loss. Oh, and a practical note: after that surgery, passing a nasogastric tube for colic treatment becomes impossible.
Wow. Okay, so a really serious step with significant drawbacks. Are there any medications, pharmacological options?
They're still pretty emerging, and honestly, the results are often inconsistent. Some drugs used are antidepressants or serotonin modulators, things like fluoxetine and trazodone, trying to address anxiety or brain chemistry imbalances. But the success is really variable, and we need more research. Then there are opioid antagonists, like naloxone or naltrexone. Based on that endorphin theory, the idea is to block the feel-good rewarding effects.
Right.
But again, inconsistent results, often very expensive, the effect doesn't last long, and they can have side effects themselves, like diarrhea or colic signs. Sometimes other drugs like dextromethorphan have been tried too.
So medications aren't really a magic bullet here either, at least not yet.
Not reliably, no.
Okay, so wrapping this all together, what's the most crucial message for horse owners or managers dealing with a cribbing horse?
I think the most important takeaway is shifting the mindset. Cribbing isn't a vice or just a bad habit. It's a complex behavioral response, often to an environment that doesn't meet the horse's fundamental needs.
It's a welfare indicator.
Absolutely. It's a sign that something is likely wrong in the horse's world. So focusing on maximizing turnout, providing social contact, ensuring continuous forage access, and diligently addressing any potential gut discomfort, those are truly the cornerstones of effective and humane management. And just a quick note for breeders. Studies strongly suggest that weaning foals out on pasture significantly reduces their risk of ever starting to crib in the first place.
That's a really important preventative point. So the key takeaway from this deep dive really is see cribbing as a complex welfare issue and take that holistic approach. Focus on the horse's natural needs.
Exactly. Maximize turnout, social contact, continuous forage, address the gut health. That's the best path we have right now.
So thinking about all this, it leaves me wondering, and maybe you too, given how deeply these environmental factors influence a behavior like cribbing, what other common horse management practices might we need to take a hard look at to really see if they align with our horse's fundamental natural needs?